Welcome back, everyone. You are enjoying another episode of Fast Facts Pharmacology Edition, brought to you by a Tale 2 hygienist in partnership with Elevate Oral Care. And now, please welcome your host, Tom Viola.
Hi, I'm Tom Viola, a certified pharmacist, dental educator, and author. Stick with me, and I promise to make the next few minutes the best pharmacology learning experience you've ever had. Hi everyone, Tom Viola from Pharmacology Declassified with yet another Fast Facts Pharmacology Edition. Well, we're continuing our investigation of drugs used for central nervous system pharmacology, and in this latest edition, we're going to talk about the drugs that are used to treat Alzheimer's disease and Parkinson's disease. Okay, in the treatment of Alzheimer's disease, the one drug that received a lot of attention originally was a drug called Namenda. Now, Namenda worked because it was able to decrease the overstimulation of NMDA receptors in the brain, which we believe has something to do with the pathology of Alzheimer's disease. Okay, how did Namenda do? Well, it did overall decrease that overstimulation and therefore improve cognitive function. But the problem was Namenda had side effects that mimicked the symptoms that many people in this age group get from normal aging, like agitation, incontinence, and even dizziness. And as a matter of fact, that dizziness was very problematic because for people in this age group, falls can be deadly. Well, what about other drugs to treat Alzheimer's disease? Well, we used drugs like Aricept, donepezil, and Exelon, rivastigmine, which were cholinesterase inhibitors. They are used to decrease the activity of acetylcholinesterase and thereby boost acetylcholine activity in the brain. Well, how did they fare? Well, they didn't cause as many adverse effects. They caused headache, sometimes nausea and diarrhea, which could be problematic. But the biggest consideration for these drugs was that they did increase the incidence of cardiac abnormalities, again, not good in this age group, and also caused hypersalivation. Now, if you're a hygienist or a dentist, you're used to pharmacists like me talking about xerostomia all the time. But this drug actually caused too much saliva, hypersalivation. Well, what about Parkinson's disease? To treat Parkinson's disease, we use drugs that increase dopamine activity in the brain. And that would be drugs like the old drug Sinemet, which we now call by its generic name, levodopa and carbidopa. Sometimes we use drugs that are dopaminergic, like Mirapex and Requip. But those drugs can have nasty side effects too, and sometimes we have to use a drug like benztropine, Cogentin, to offset or to minimize those adverse effects. All right, well, how did those drugs fare in treating Parkinson's disease? Well, again, great drugs and were used to some success and still are, but they cause adverse reactions like dizziness, again, problematic in this age group, sedation, again, problematic in this age group, and hallucinations, which is again problematic in this age group. So unfortunately, the drugs that we're using to treat both Alzheimer's and Parkinson's disease cause side effects that mimic what these patients in this age group already have as normal effects of aging. To finish up the Parkinson's disease drugs, remember, in addition to those nasty side effects, we're also talking about xerostomia and even dysphagia, which is, again, problematic in this age group. Xerostomia can cause rampant caries, and dysphagia can cause a choking hazard. So there you have it, my friends. We're on our way for treating these two notorious conditions, but the drug therapy, well, more to come, I'm sure. Thanks so much for joining me today. This is Tom Viola with yet another Fast Facts Pharmacology Edition. See you all real soon. Oh, and one more thing. If you want to hear more from me, be sure to follow me on Instagram, Facebook, or visit my website at www.tomviola.com.
Thank you for listening to another episode of Fast Facts Pharmacology Edition, brought to you in part by Elevate Oral Care, creators of the innovative and proven prevention-focused oral care products from Advantage Arrest Silver Diamine Fluoride to Fluoramax Sodium Fluoride Varnish. Learn more by visiting www.elevateoralcare.com and schedule your free CE staff meeting today. We'll see you next time for another Fast Fact.